Vidal Sheen is an internal medicine and phlebology certified physician practicing in Missouri. His practice specializes in aesthetics, functional, and regenerative medicine. He integrates root cause concepts with the latest technologies such as platelet-rich plasma, photobiomodulation, or better known as red light therapy, and laser technology to accelerate and promote natural healing, helping his clients resolve the chronic healthcare issues, aesthetic, and regenerative needs. So, Vidal, what led you to focus on regenerative medicine and functional care?
Well, I started out in the internal medicine business, and then I got into the vein business, and then as insurance companies changed, things like that, I started migrating into other areas. And what caught my eye really was the functional side of it, because if most people actually, what I found over the last 20 years is most people actually don't understand what functional medicine actually is. Um, it's just a little bit of a history lesson. It was sort of the type of medicine we practiced prior to the 1900s, where basically, you give someone some type of, herbal medicine or root or something like that for some type of medical symptom. At that point in time, because our medical knowledge really wasn't very extensive, it was really sort of, voodoo medicine to some degree. But over the last 120, 130 years or so, we've acquired a lot of medical knowledge in terms of medical physiology, how the cells work, how the tissue regenerates, all this kind of stuff. And so now when you combine that mentality with that type of knowledge base, it becomes a root cause treatment. Okay, because we can actually target certain mechanisms within the body for certain disease processes and actually potentially reverse them. But unfortunately, modern medicine is hasn't caught on. Um, but as I got more and more into that type of arena, it became much more fascinating to me because you start to realize all the flaws with modern medicine. Granted, I've never been a anti-modern medicine or anti-traditional medicine type person by any stretch of imagination, and definitely not anti-pharmaceutical or anything like that. But you start to see the benefits of not going down that road and actually targeting what actually causes certain things as opposed to just treating certain symptoms. And that's sort of how I got into it. So that's why for probably the last 5 years or so, I've been working on this side of it because it's a complete change in mentality. It's a complete different approach to modern medicine or to medical conditions, something that was never really taught in medical school. And really at this point still is not being taught in medical school. It's stuff that people have sort of caught on to, but how much people actually take it to the really to the degree that we take it to is another story.
So yeah, that's you bring up a few interesting points there. I mean, when you talk about functional medicine, it just seems like such an obvious solution. Like, why not focus on the root cause? What do you think holds people back from exploring functional medicine further?
I think talking to people, I think people are looking for it. I mean, more often than not, people are looking for a way of okay, they don't want to take this medicine, they don't want to take just take pills because they see how it makes them feel afterwards. Because yes, it may take away their symptom, but there are side effects to it, and they can manifest in different types of a different symptom or something else that maybe it's not as bad as what they were originally presented with, but it's still a symptom nonetheless. Um, and so I think people are looking for it. I think people don't really understand what it is, though. Like I said, most people don't understand the term functional medicine or even some type of people call it like integrated medicine or root cause medicine. They're all sort of the same thing to some degree. But I think people are looking for it. It's just that they don't know what to look for and they don't know what the potential of it, of that type of therapy actually is, because no one's ever taught them that. Think about there's a lot of medical information that is not actually based in medical fact. It's actually medical fact in a person's mind purely because mom and dad told them this is the case or that's the case. But the medical data doesn't back it. Just like there's certain things in modern medicine that really medical data truly probably doesn't really back if you really start to delve into the information. Because people have to realize, like, yeah, I never thought this years ago was never came to mind was people always talk about physicians practicing evidence-based medicine, but you have to realize if you sit back and you think who generated that evidence. Unfortunately, a lot of the pharmaceutical companies generate that medicine, that information. And so it all is very pro medication, pro pharmaceutical, because in reality, if it was something that was truly fixing something, they wouldn't do those studies, right? I hate to say it, but there's no money in cures. Yeah, you'd rather, there's that old, what was it, that old Bart Simpson episode where they talk about, um, where they're talking to some pharmaceutical guy, and basically they're saying, well, why would I cure it when I can just string you along for 30 years and have you take my medicine and make money off of you? Um, that's unfortunately, that's the truth. From my perspective, that's my perception of it.
Yeah, that is something very interesting. I think this next question will kind of take us a little deeper. Many patients come to you after trying other treatments without success, right? Like you said, they're trying the same thing over and over again, which
Right.
some would say like is the definition of insanity. So how do you approach their care differently from the start?
So it depends on the condition, right? And so, take for instance fibromyalgia. It's sort of that all-encompassing diagnosis where basically people, the physicians on that side don't really understand what's causing, say, someone's discomfort or chronic fatigue or whatever it might be. Um, Whereas when you really sit back from my perspective, I'm looking at it as, okay, you have this diagnosis. So first off, one, what are your symptoms? Okay, are you having body aches? Are you hurting? Are you fatigued or whatever it might be? And then I'm starting to target what causes it. Because for a lot of diseases, if you really sit back and you really look at it, there's only a few things that really cause diseases. One is inflammation. Two is your immune system is off. Okay, so you see a lot of autoimmune diseases, things like that, where if your immune system is off, your body doesn't know how to differentiate what's you versus what's someone or something else. That's autoimmune disease. So it starts to attack yourself. So the way I look at it is, and I approach most problems this way, is if you were not born with it or you didn't have it at 5 years of age, it's not. It's something that is potentially fixable to some degree, unless you had permanent damage from it. Say like you had Alzheimer's, and you've already to the point where you can't remember anything. You're really not going to fix that. But if you can catch someone early, you potentially could slow it down and make it draw out so it becomes more of a chronic disease but it doesn't get to the point where you're fully debilitated. That's sort of how I'm approaching things at this point. So I'm looking at them, whatever medical problems you have, or whatever symptoms you actually have, and actually trying to figure out, okay, this might cause it. These are the 10, 15, 20 different things that might cause it. Let's start to target every aspect of those and start to neutralize them. That's sort of how I address the root cause side of it.
Interesting. And I mean, you speak a lot on online forums about the power of functional medicine, and obviously that plays a huge role in your practice and what you do. Have you seen any success in seeing other physicians adopt some of what you're talking about or what you're teaching?
Well, the thing with functional medicine is that there's, unlike in modern medicine, where you typically have, I guess, three different types of providers. You have an MD, you have a DO, and then you have typically nurse practitioners. I guess a fourth. There's physician assistants as well. When you get into functional medicine, though, if you really sit back and you look at everyone's credentials, you have MDs, you have DOs, you have naturopaths, you have chiropractors, you have holistic people, you have just traditional nurses or NPs and who do it. The problem is that if you really sit back and you look at their educational background, they're different, right? I mean, you have holistic people who don't have anything close to the same type of medical training as a physician does, but the same side, the physician may not have the same holistic side of it that holistic person does. So there's no one who's out there who really is all encompassing as far as that goes. That's why you can go to one function or so one self-proclaimed functional doctor, who might be, say, a chiropractor, another one who's a naturopath, another one who's an MD. You probably will get different treatments and to different levels of treatment, depending on how much that person has really gone down that side, and how much they've researched the information, how much they've actually learned stuff, and that's where it's a gray area, because I've seen people who've gone to other functional doctors. They've sort of hit a plateau, and you start to look at their stuff and what was been done. And he's like, realize, well, they're missing this. Um, that just from my perspective, in terms of how I would approach things. Do they get certain things right? Correct. Yeah, they do. but there's certain things that they're missing, they're overlooking, or they just take it for granted that, hey, this is okay, when in fact, most of the time it's not.
Hmm. So let's say I am somebody who suffers with fibromyalgia. I've spent 10 years, and for those who may be listening who don't know what that looks like, it just looks like intense pain that's really undescribable. It's like you
Right.
have this intense pain, no one can really treat it, no one understands. What would you do differently in that situation? What kind of questions would you ask to help that person realize, what the next direction looks like for them?
So the very first thing you always ask is what's been done, right? What have they tried? If it's more traditional medicine, pretty much you can guarantee they tested for everything, all this kind of stuff, and nothing pans out. That's why they've been given that diagnosis. It's unfortunately sort of the diagnosis of exclusion. We've looked for everything. We can't prove you have anything, but you're obviously having pain. We can't deny it. We're going to give you this diagnosis. Um, Now, from a functional perspective, how I'm approaching it is, like I said, I'm thinking more along lines of inflammation, of other disease processes, and I'm looking at their symptoms beyond just the discomfort side of it. Because when you think about if you have muscle pain or you have nerve pain, you have to remember it's not just anything that goes from your brain. It could be within your brain. It could be within the nerve endings. It could be a mineral deficiency, vitamin deficiency. A lot of people who have neuropathic type pain are actually B1 deficient. So are you taking those supplements? Are you taking things like that to account for all those variables? And a lot of times they're not. Most of the time they're not, because it's never addressed. But those are things that can give you nerve pain, can give you symptomatic issues. Then on target, a lot of, most people have what I feel is like people have GI issues. So even if you sit there and you feel like, hey, I feel fine, because of the nature of our food, the fact that there's so much antibiotic prevalence within our food, antibiotic use within our society, guaranteed if you've ever had anything along those lines, your gut probably is not normal unless you've been doing something to try to remedy it. And so when people's guts are abnormal, it causes a lot of problems because your gut dictates a lot of your disease processes. I mean, they always say Hippocrates said the right thing. I mean, disease, probably 90% of diseases start in the gut. And it's true. You think about your gut dictates how you handle cholesterol, how you absorb your nutrients, how you, or whether you absorb your nutrients. Do you have parasite issues? How your body, has, you have all these bacteria in your gut, basically, that your body actually doesn't, is having bacteria isn't necessarily a bad thing. Because your body has to work synergistically with the bacteria, because there are certain things bacteria will generate your body doesn't make, but your body needs it. And so, prime example is people, there's certain bacteria in your gut that generate what they call butyric acid. Well, you need butyric acid to generate energy in your cells. Well, if you don't make it, if you don't have that bacteria, or you have a fraction of that bacteria, your body's not making the energy necessary to function. So voila, you may have chronic fatigue issues. You may have things like that. Your cells may not turn over well. You don't heal well. All of it sort of compounds itself. So those are things I'm looking at as far as that goes. So, and oftentimes even by talking to people, I can't tell if your problem is due to a GI problem, is due to, you know, an allergy. I can't tell you if it's due to all these different things, because there might be 10 different things that can cause your problem. And it's just a matter of, for me, if I'm trying to optimize your health, I'm targeting all those elements, and let your body fix itself by taking out or addressing certain variables that might impact or cause your problem as far as that goes.
Yeah, it's like they always say, you got to trust your gut. And
Right.
if, and if that means, yeah, and how, yeah, what kind of variables do you take into your decisions around treatments?
Um, I mean, honestly, there's certain things they always tell you never make assumptions, things like that. But there's certain safe assumptions that are pretty easy fixes. Like, I'm a big believer most people are nutritionally deficient. Why? Because the nutrients in the food, things like that we eat, whether it be processed or even naturally grown, are not the same as what they were back in, say, the 1940s. Just because the soil nutrients are not the same, they're more. The soil we use now is much more depleted. We can't use, even organic foods. You can't use fertilizer. You can't use things like that. But you think, okay, that's good, right? But fertilizer has nitrates in it. You need nitrates for nitric oxide production within your body, which impacts blood pressure. Nitric oxide is a neurosignaling molecule. All those types of things impact your body's function. And so there's so many things that I can't fix because you live it, right? You live based on the types of food you eat, your environment. Obviously, you have to consider people who have, you know, heavy metal toxicities, things like that. There's everyone's different, and so everything we do is customized to that individual as far as it goes. Um, but again, it comes down to just starting to target each individual potential mechanism that's causing certain things, and you can start to fix certain things. You'll start to see symptoms go away. You'll start to see your cells turn over faster. You'll start to see all the benefits of giving your body what it actually needs.
Hmm. Yeah. What kind of hope would you give to people who have been dealing with something for years and years, um, and they want to know what their next step is?
Well, the thing is, if you have a chronic disease, like as you're alluding to, and you tried everything, um, you need to have an open mind, because just because your family doctor hasn't mentioned this potential treatment or this potential approach doesn't mean it's not a viable approach. Because I can attest to it. I mean, I see it on a daily basis. You see the benefit of it. You see how people see their brain fog go away, or see how they could never lose weight before, but now all of a sudden now they're starting to lose weight as you start to fix them, sort of the innate mechanisms within the body that they didn't know they were actually fighting as far as it goes in trying to lose weight. Um, so you have to keep an open mind about it. That's why when I got into this business, I realized there's really two groups of people. The first group is basically are people who basically focus only on traditional medicine. That's all they believe in. Okay, it's whatever their primary doctor, their specialist, whatever have told them. Um, and then you have another group where, okay, they've heard their primary doctor, they don't like what they're hearing, they want to know, hey, is there some other alternative? And those people are the ones you can really help, because they're the ones who are open to a different alternative type of thing. Um, again, everything I do for the most part, a lot of what I do now goes against the grain of what modern medicine actually does. Because my intention when I treat people is not, hey, I'm going to try to bandage your symptoms. I'm trying to actually reverse them if I can. And I'll be honest with you, sometimes you can't, right? There are situations where you cannot fix it, but you can maybe temporize or make it much more bearable for them, so they're not reliant on narcotics or reliant on this medication or that medication, and do it that way to make them more comfortable and more naturalistic in a sense.
Very good. Yeah, I always like to end these conversations with a question about the future. What kind of regenerative medicines are you most excited about looking 5 to 10 years in the future, or maybe where your practice will be in 5 to 10 years? What's your vision there?
I mean, there's a lot of natural stuff, sort of what we call allopathic type things, where you're using your own body's healing mechanism, where you get into what they call PRP or PRF, and even stem cells. I think that's already there. If you were to ask me, okay, what excites me going down the road? Probably the peptides. Um, and if people don't know what that is, basically they've been studying all these different types of chemicals and things like that, and they'll take certain sections of what they call amino acids out of those sections, and they figured out, hey, these 16 amino acids will generate or help you heal this or do this for you or do that for you. Um, that's very interesting as far as that goes. Now, is it going to I mean, obviously, it's a growing area of medicine. But a lot of it is still on the research side of it, because people hear about, and I hear about, okay, there's what did they call, like SS31 and things like that help mitochondria. You may be able to get it, but it's only from the research side, which means I can't do it. But eventually, I'm hoping that those things like that will show up on the commercial side, where we can actually use it to help our patients as far as that goes. Because what I've seen is it's potentially very beneficial to people. Um, but especially when you get into neurodegenerative diseases, things like that, where you have mitochondrial dysfunction and all that. I'm trying to do things to circumvent that right now until I can get access to those types of things because legally I can't give you those things at this point just because they're still in that research phase. Um, but hopefully things will come out more and more on the market that are beneficial, um, that you'll see things target certain mechanisms, certain disease processes that may be helpful for certain diseases.
Yeah. Is there anything that maybe we didn't cover today that we should have?
Um, I mean, from my standpoint, and again, sort of connecting on to your last question, I would love to see us go towards more towards a functional mentality in modern medicine because, if you look back in the last 30 to 40 years or so, all you've seen is an increase in chronic disease processes, right? Certain disease that, I'm older than you are, but the reality is that I've seen, even in my window of time, you've seen diseases that were really really rare when I was training, and now it's like every single day you see it everywhere. I mean, probably when I was training, I'm guessing there's probably maybe 4 or 5 autoimmune diseases. Now there's like 130 or 140 different named autoimmune diseases that we know of. It tells you something's not right. We're not doing something right in the modern medicine arena, because we're treating acute symptoms, not getting rid of the problem or the root cause, and that acute symptoms ultimately going to become a chronic disease somewhere along the way, just because you're not fixing it. It's just like you putting duct tape on your cars, water pipes, and it's like somewhere along the way, it's going to become a chronic problem. It's going to be an issue, and that's what's happening right now. And then people worry about all the cost of healthcare and everything else. It's big, yeah, because you're feeding chronic diseases. Most of the money we're spending is on chronic diseases. So why not fix the problem and get rid of those diseases? Prime example is like type 2 diabetes. For most people, if you're willing to do what you're told, you can fix it. Well, if you think about, I think I read somewhere what was it, type 2 diabetes or diabetes itself is like $150 billion industry annually. Well, if you think about what diabetes also causes, it causes vascular disease, eye problems, kidney problems, you name it, vascular disease. It's not a $150 billion industry. It's probably a $2 trillion industry once you figure in all the other diseases that are connected to it directly. Um, so if you somehow were to neutralize diabetes out of the mix, how much money did you save? You probably cut your healthcare dollars by at least 30-40%, because all the secondary manifestations of diabetes go away. So, but that's not what we're doing right now. Unfortunately, we're just feeding the disease, feeding it to make it worse and worse and worse. The way we're going right now, my fear is that we're going to continue to see more and more diseases just keep climbing and climbing in prevalence and prevalence. And it just keeps going and going, and we're seeing that now. You got somewhere along the way, you got to cut that off.
Yeah, I really hope, through podcasts like this and as we get more business leaders in this space thinking about functional medicine, we can start to see those shifts take place.
Well, I mean, one point I'd like to make though is the problem with it is even if we were to somehow transition fully to like a functional mentality, I don't think the providers are there. If you take the traditional physician, primary care doctor, internist, whatever it might be, they're not wired to treat in the functional arena. They think differently. That's why, for me, I was trained in that arena. It took me the last 5 years to sort of work out all the kinks and figure out how to change or how I approach medical conditions. And it's a complete 180-degree change. And I'm not sure we have the providers the necessary to do that. Not without sitting there shifting the medical educational arena in terms of actually changing how we teach, um, physician assistants, MDs, DOs, you name it, because they're all still taught, indoctrinated into the traditional medicine scheme. And to go just transition naturally to functional medicine, it's a major change. It's a different approach. And I don't think we have the providers for it. I don't think we'd have the infrastructure for it. But that's what we need to go towards in that direction. Um, but but unfortunately, it's unless we change something else in terms of the educational process, things like that, it'll be a lot more long drawn out affair as far as that goes.
Well, maybe Sheen Van and Cosmetics will just have to grow and grow to fit, to suit the needs.
I'm old. I don't know. Um, but definitely I get a lot of enjoyment in helping those people, helping people who come in who have chronic issues. And you start to see the things go away. That's very rewarding. But again, makes it only reinforces the fact that we really need to go in that direction more so than what we're doing now.
Yeah. Well, luckily the personal connection is the strongest, and I hope that as you help, one person and one person, it's like that starfish story, right? Like
Right.
hundreds of starfish out on the beach, and this girl just keeps throwing one more in. But at least to the people in your practice, it makes a difference for them, and it makes a difference for me. Thank you for taking the time today.
Oh, thank you for having me.